Well, welcome back to Indab Africa. Chris White here from Central Pennsylvania, wearing the Irish Rugby Football Union road jersey for the 2019 World Cup tonight. World Cup cap here. We are now just 10 minutes away from Zimbabwe going on nationwide lockdown as the clock turns midnight in Southern Africa and it becomes Monday there. The government of President Emerson Mnangagwa has determined the country will go into nationwide lockdown, which takes place here in approximately 9 minutes at this point. So thank you for joining us this evening. We're going to stay on the air for a little while, and we'll talk about the current state of COVID-19, the Wuhan coronavirus around the globe. Mentioned Pennsylvania as well, where I'm at. We'll talk about Southern Africa briefly and some of the things that have happened in the region today as Zimbabwe goes on a lockdown. Well, as I said, here we are on the 29th of March, 2020, and the Wuhan coronavirus, or COVID-19, is causing even more disruptions in Southern Africa. But before we talk about Southern Africa, since we got a couple minutes here before the top of the hour, let me talk. Oh, not supposed to do that. Touch your face. That's okay. Just wash my hands. I'll be all right. So the data is old the moment you write it down. And so I collected this data a bit over an hour ago, got the most current data that was available then, but it's already out of date. But as of an hour ago, over 710,918 people, that's now over 712,000 people, have been confirmed with the COVID-19 virus. 33,551 people have perished from this virus, which came from the Wuhan area of China. In the United States, we have the sad distinction of being the country with the most confirmed cases. That in part has something to do with the fact that we have a lot of testing going on now, but it's not the reason. It's also the size of our country, the mobility, international travel, and of late, people not adhering to guidance from the federal government, state, and local officials on how to avoid transmission and how to maintain social distances. Now we have a number of places in lockdown here in Pennsylvania, in York County. We are in lockdown along with several other counties, starting from Philadelphia and working their way over the Susquehanna River to us, jumped the river, it came to us. So in Pennsylvania, we have 3,394 confirmed cases of COVID-19 and 38 fatalities. So the 3,394, that equals 2.5% of the total confirmed cases in the United States as a whole. The United States has an estimated population today of 331 million people. Pennsylvania has a population of 12.8 million. That means that we currently have 3.9% of the nation's population, but we're only showing 2.5% of the confirmed cases. Nonetheless, that's a huge jump from just a short number of days ago. We had only a few dozen, and now we have nearly 3,500 cases. Here in York County, the number jumped up from, I think it was 29 yesterday, to 43 confirmed cases of COVID-19 in York County, Pennsylvania. That's a county that borders Maryland on the south, Susquehanna River to the east, and Adams County, Cumberland County to the west, and to the north and east, we have Dauphin County, which is where Harrisburg, the state capital, is located. So York County, 43 cases of COVID-19 confirmed and 0 fatalities in the county thus far, but 38 statewide. There you have it. So let me give you the figures for Southern Africa here. Not much in the way of changes across the region, but a few changes. South Africa figures finally came in for the day, and South Africa's confirmed cases of COVID-19 jumped up to 1,280 today. That's an additional 93 cases, and they added 1 confirmed death from the virus, raising the total back up to 2. You may remember that it was at 2. But one person who died was a false positive, and that person was taken off the count. And now we have another person who's passed away. So 2 have died in South Africa. We previously had the 30-year-old journalist that died in Zimbabwe a few days ago. And now today, I'll get to it in a moment, but Angola's had 2 fatalities. That puts us at 5 there. South Africa, 1,280 cases, confirmed cases of COVID-19. But the bad news, which I'll talk about a little bit later, after we cross the threshold of the top of the hour and Zimbabwe goes into nationwide lockdown, I'll talk about the townships in South Africa and some worrying signs about what's happening there. So next in Southern Africa, we have Zambia with 29 cases. That's only 1 additional case today. A good improvement over the last 3 days in which it climbed up from less than 10 and made its way up, approaching 30. Today, just 1 additional case. Zambia with 29 cases now. So we have Namibia with 11 cases. That's an additional 3 cases today. These sound like small numbers, folks, but bear in mind that a lot of people who are sick or who are asymptomatic and carrying the virus are not seeking medical care. And even those who are seeking medical care aren't necessarily being tested. So it's likely that there's far more people that are infected with the virus at this point, even though these are low numbers. Namibia 11, 3 additional once again. Eswatini, what used to be known as Swaziland, has 9 cases, no fatalities. Mozambique up to 8 cases, no fatalities. Angola 7 cases, and as I mentioned, 2 fatalities. That's 2 out of 7. That's pretty high. It might just be circumstances. It's too small a sample to get real data from that. Zimbabwe 7 cases, and of course we had the 1 fatality previously. And that's your total for the countries in Southern Africa and the Southern African Customs Union and those neighboring right next to it. So there you go. We're now 4 minutes away from the hour of midnight in Southern Africa. We're in Harare and throughout the country in Zimbabwe, from Masvingo to Bulawayo, all over Plumtree. The entire country will be going into nationwide lockdown, joining Zambia, which is on a 14-day lockdown, Lesotho, which yesterday went into a 21-day lockdown, South Africa, which is now in its 3rd day of a 21-day lockdown, and Namibia, which is also on a 21-day lockdown. Botswana has yet to report a case, and neither has Lesotho to this point. Botswana has not implemented a nationwide lockdown, although they have warned citizens to be prepared for it and for residents. So they're not there yet, but they're getting close. So there you go. We are now 3 minutes away from midnight as we approach the top of the hour. And I imagine that folks in Zimbabwe are a little bit concerned. One of the things we should note that in Zimbabwe, as a consequence of the economic crisis, coupled with the concerns about COVID-19, the government has backed off of banning the use of foreign currency. And once again, folks are legally allowed to use foreign currencies. So the US dollar is once again in circulation in Zimbabwe, and most likely you also find people using the rand as well. So there you have it. There's already one thing that's changed in Zimbabwe. Of course, this is a country with a very checkered history of the security forces and their treatment of Zimbabweans. And we saw last year during the elections, after the elections were over, and the opposition party supporters were complaining and protesting in the streets when the army fired and killed protesters. And we've seen the security services spy on Zimbabweans. We've seen extrajudicial killings of opposition party members and politicians. Of course, the farm invasions and murders of several hundred Black African farmers, along with a few dozen white commercial farmers. It's not a very proud history. And so when a country like this undergoes a lockdown, it's definitely a concerning time, something to be worried about. So here we go. We're down to 2 minutes now, 2 minutes to go, and we will cross the threshold where Zimbabwe goes into a nationwide lockdown, joining its neighbors, with the exception of Botswana, which is not quite there yet. All right, so this the situation in Zimbabwe is already pretty bad. People can't feed themselves. A lot of people are surviving off of food aid. A large number of people, of course, have HIV in the country, pervasive poverty. The government has an unpleasant habit of wiping out people's savings by their macroeconomic policies, which lead to hyperinflation, and inflation is back once again before they switch to foreign currencies here this past couple of days. So the situation for folks in Zimbabwe in many cases is grim. Not everyone, but many places it's very grim, and it's very concerning. Now, 1 minute before the top of the hour, as we look to our friends in Southern Africa and Zimbabwe in particular, where 14 million people in Zimbabwe are about to go under a nationwide lockdown for the next 21 days, which will take them out beyond South Africa's 21-day lockdown, presuming, of course, that President Cyril Ramaphosa and the ANC government do not extend that nationwide lockdown. That's a very distinct possibility, and I'll talk about that as we cross the threshold and we talk about the news at the top of the hour here. All right, less than a minute to go. We got to about 20 seconds to go, folks. And folks in Zimbabwe will go into lockdown. Very close. Well, as we approach the top of the hour, 10 seconds, let's wish everyone in Zimbabwe the best and hope that they hold out and hope that everyone is able to get whatever provisions they need for themselves and their family, and that people don't get carried away with alcohol and abuse family members, or the fact that you're around the family. And it's now 6 p.m. on the East Coast of the United States. It is midnight in Southern Africa. Zimbabwe is now in nationwide lockdown as a consequence of the Wuhan coronavirus, or COVID-19 by its scientific name. And there you have it. So now let me turn attention here very quickly to some of the events that took place, some of the news that came out of the region, Southern Africa today. Looking at the American Embassy's website, and it's released to its wards to let registered Americans know the news about what's going on. The American Embassy noted that there would be a final flight out of Harare today on Ethiopian Airlines, and that flight was destined for Dulles. And the charge, well, if you wanted to fly on it, presumably you had to be an American. The other thing is that you couldn't go through a travel agent. You had to book directly with Ethiopian, and they give a contact number to contact Ethiopian Airlines to get on that flight. And the charge was reported to be $2,400 to fly one way. It wasn't clear about two ways, but you can't come back. So I don't know if they get a round trip, but $2,400 to get out of Zimbabwe and get back to the United States. Now, I'm quite puzzled by all this. I thought that we had international travel ban. I don't know if Ethiopia was contracted for this flight, charter flight, so that they could bring American citizens and green card holders living in Zimbabwe back here. I'm not sure if that was the circumstance. Whatever the case is, I was a bit surprised to see this. So it made me wonder, it made me think about this. Does that mean that there's a lot of aircraft in the air? I don't know if people out there watch, but one of the great sites to follow actual aircraft in the air is a site called FlightAware, one word.com. If you go on FlightAware, you can see aircraft and depictions of aircraft that are flying around the world. And that's what I'm doing right now. I'm looking at the aircraft, and I'm just astounded at the number of aircraft. For instance, there are 3 aircraft flying over Lancaster, Pennsylvania, just to the east of here, one just below my house, one just north of here, and generally in the vicinity of central Pennsylvania, I see about 40 aircraft in the air. With no international air travel, these are obviously all domestic flights. So I'm not really sure about this Ethiopian flight, but this is what the American Embassy in Harare put out for Americans, and I'm just curious about it. I would hope that when those people land, they must be sequestered, quarantined, tested for the virus. I'm not sure, although the odds of getting it seem to be greater here than they are in Zimbabwe at the moment. All right, so Zimbabwe 21-day lockdown today, March 30th, still the 29th here in the States, but it's now March 30th in Southern Africa. Zambia on a 2-week lockdown. Lesotho, their 3-week lockdown, 21 days, began yesterday. And Namibia is also on a 3-week lockdown, which began a few days ago. And of course, I mentioned South Africa is on a 21-day lockdown, day 3 for them. So specifically, I mentioned South Africa. Let's talk briefly about that. In South Africa, reports today that there have been confirmed cases in the townships in the Cape Flats, in Kalicha, in Western Cape. If in fact this is true, this should be a very troubling sign for folks. Townships are densely populated. Oftentimes, many of them have informal settlements or shacks and shanties where people live. And people live in very close proximity and interact extensively. Keeping folks locked down for 21 days in a township and not interacting with each other is very different than asking people who live in a leafy suburb of Cape Town or Simonstown or Nelson Mandela Bay or Pretoria or Sandton, who live behind big walls and have space that they can move around on their property and not interact with others. That's a very different situation that we're talking about in the townships in South Africa, where people are right up against each other. That in itself could prove to be disastrous as a breeding ground for this virus. It makes me think of the slums around Nairobi that have sprung up and virtually crowded out most of the town as they've expanded around the edges of Nairobi and spread the center of Nairobi and the city even further and further out. Hundreds of thousands of people living in these tight slums. With the Kenyan curfew in place, now a lockdown in South Africa, one can only wonder what will happen with the virus making an appearance. It was just a matter of time to be in the townships, but now it's confirmed in the Cape Flats that there have been reported cases of confirmed coronavirus, COVID-19. That's a bit stressing. In Namibia, the Namibian Defense Force is out working with law enforcement to help enforce their lockdown. Of course, I mentioned yesterday that in South Africa, the South African National Defense Force, or SANDF, is augmenting the SAPS, the South African Police Service, as they implement the lockdown around the country. And there were reports of firing of rubber bullets, some rough treatment of some people who were not obeying the lockdown. And there were a number of people obeying it. But authorities in South Africa are telling the press and telling the world that for the most part, the majority of people in South Africa at this point are complying with the lockdown, and they've had few problems. It's just that the ones that have appeared, the press has quickly reported them, and they haven't focused on the fact that things are under control. And it could say the same thing for the rest of the region, despite concerns, despite fears. People very much worried about this virus and what it means and its impact, and whether it'll get them or their family. It is relatively calm, and people are relatively well behaved. If that'll continue is the question. We shall see. In the midst of all this, in this storm of COVID-19 and nationwide lockdowns, we have the land of Botswana right in the center. In Botswana, the government has yet to issue a nationwide lockdown order, but it has warned folks. But people on the street are very concerned. Rumors are running rampant. People are not believing that there is no confirmed case of COVID-19 in Botswana. And that's a bit distressing. Good leadership, as I mentioned in a previous video earlier today, would be out in front of this. It would have the health ministry out on BTV, Botswana television, or the radio, and they would be, both of them, and would be talking to the public, reassuring the public, and saying things like, we have the capacity to test this many people per day in these locations. I'll just make something up. I have no idea what it is, but let's say they could do 2,000 in Gaborone, 1,000 in Maun, 2,000 in Francistown, and that they get the results in these number of days. And they should also tell people that they've had a number of false where people thought they had the disease, and in fact they're tested and they have something else like influenza or another ailment related to something. But the government's not doing this, and this is a bit distressing and a bit concerning. If you are going through an event like this, you need transparent governance. You need the government to be straightforward with you. And when you're not, and people are just waiting, it's not a good scenario. People's imaginations run wild, their thoughts get out of control, and they behave irrationally at times. That's a very real possibility. So my recommendation to President Masisi and the BDP, the Botswana Democratic Party, is to get out in front of this now. Don't wait. In the morning, you should have someone from the health ministry on the broadcast telling the public what's going on. There are no confirmed cases of coronavirus in Botswana. However, it is possible that it is already here. So practice social distancing. We have not started a lockdown, and so on and so forth. This is what responsible, prescient, forward-leaning leadership does. It looks out for the welfare of its citizens and for country. And this is what the government of Botswana should be doing, but it's not doing right now. And that may come back to haunt them in the end. They've taken a lot of good measures, a lot of good steps. I don't mean to criticize them, but what I'm saying is that they owe it to their citizenry to get out in front of this and let people know what's going on. So there you go. Let me recap. If you're listening in and you like this, please feel free to give a like to the video. Happy to get those if you like it. If not, oh well, you don't have to like it. If you're not a subscriber, feel free to subscribe to the channel. So once again, as of an hour ago, around the globe, 711,000 confirmed cases of Wuhan coronavirus or COVID-19, and sadly, 33,551 fatalities as a consequence of that virus. Here in the United States, we have the sad distinction of being the country with the most confirmed cases of Wuhan coronavirus. That would be 135,499, or 19% of the global total, up from virtually nothing just a few weeks back. The fatalities in the United States are 2,381, or 7% of the global total. So we have 19% of the cases on the planet, but only 7% of the fatalities. One would suspect that has a lot to do with the fact that Italy is really, sadly, getting a large number of casualties from this. Last time I checked, it was over 11,000 at this point. That's quite something else. A country 1/4 the size of the United States, and they have 5-6 times what our fatalities are at this stage, and we have more cases. In Pennsylvania, we have 3,394 confirmed cases as of today, and that's 2.5% of the total cases in the United States, and 38 fatalities. Now, Pennsylvania itself as a state, the country has 331 million people. Pennsylvania has 12.8 million people. That's 3.9% of the population. So relative to our percentage of population, Pennsylvania is currently lower because we have 2.5% of the confirmed cases, but nearly 4% of the population. And that may in fact change quickly, as we've seen with COVID-19. And then here in York County, Pennsylvania, 43 confirmed cases, up from 29 yesterday, 0 fatalities so far. Hope that holds for people. And once again, very quickly, in Southern Africa, South Africa had a gain of 93 today, puts them at 1,280 cases in South Africa, an additional fatality, raising their total to 2. Zambia with 29, Namibia with 11, Eswatini with 9, Mozambique with 8, Angola 7, Zimbabwe 7. 2 countries in the region still not reporting any confirmed cases of COVID-19. That would be Botswana and Lesotho, neither one of which have any confirmed cases. But Lesotho is on a nationwide lockdown, as is Zambia, Namibia, South Africa, and as of 11 minutes ago, Zimbabwe. There you have it, folks. There's a rundown of what's happening in Southern Africa and a little bit about what's happening globally and here in central Pennsylvania. So if you like the videos, please give us a like, push that button. That's always popular. We like that. If you're not a subscriber, feel free to subscribe. It is a free channel, and we hope that this is informative. And it's just an effort to get people up to date and let them know what's going on with events. Oh yeah, there's one thing I should raise this before I go. The Human Rights Commission in South Africa is at it once again. They are actively investigating a woman who was videotaped teaching people how to wash their hands. The fact that there were Black South Africans in that group being taught, someone presumed that this was a racist for her to teach people how to wash their hands. I guess they felt insulted by it. So she was arrested for racism. Yeah, it's shake your head. Anyway, there you go. There you go. So South Africa today, there's actually real racists out there who are a threat to people, and we do things like this with someone who's trying to help people in the midst of a public health crisis. Same thing healthcare workers are telling people to do. She's doing it, and she gets arrested for it, as if there's nothing better to concentrate on. Once again, if you like the channel, please subscribe. If you like the video, please give us a like. And also, feel free to give us comments. I'm happy to listen to your comments and respond to them. And if you have an idea, write to me, send me a note, and I'll entertain ideas for future videos. But this is just kind of like, at this point, the daily update on COVID-19 in Southern Africa and central Pennsylvania, which in most respects have virtually no link other than me. And with that, folks, thank you very much. Stay healthy. Take care of yourself. Take care of your family. And as Ray Green would say, keep your stick on the ice. We're all pulling for you. Take care.